Hello and welcome back to another episode of Rotator Expert. I'm Dr. Daniel Orcutt, and today we're going to talk about shoulder pain. How long should you wait before you go see someone about it? So that's a kind of a typical question, but it's a hard question to answer. I think some of it depends on how bad the pain is, how did the pain show up, like what created the pain. And so we'll kind of separate that into two categories. One category is a traumatic injury, and the other category is kind of a overuse or long-term injury or pain. So let's say traumatic. Traumatic, I'm out in the yard playing with my kid and I slip and fall and get my arm get yanked back behind me and now I have pain. And so do I go right away? Well, probably not. I mean, there's nothing wrong with going to the emergency room right away if it really hurts a lot, if you think maybe you broke something. Or you think you dislocated your shoulder, certainly not a bad idea. Again, this is not necessary medical advice. This is just my general advice to you. Obviously, if there's any questions, really, truly medical advice should be given by your primary care doctor or your orthopedic surgeon. So that's an important caveat for this video. But you fall down and you hurt yourself and you have a decision. Well, do I go to the emergency room or do I not go to the emergency room? Well, again, if you think you're seriously hurt, certainly you do. But if you say, it's kind of sore, so maybe you wait a few days, you rest it, you ice it, you take anti-inflammatories if you're able to, and see how you do and see how you're feeling. If you're not better, probably if you're not better within a month or so, you're probably not going to get better. If you're having a lot of pain before the month or so, then I would certainly recommend you go see at least your primary care doctor. Certainly you go to urgent care. Obviously, in my opinion, the most important person would be the orthopedic surgeon if it's really a shoulder issue, so they can get x-rays and then they can evaluate you, right? There's a combination of both, because most of the time, and this is key, most of the time when we look at shoulder problems, if we get an x-ray of the shoulder, most of the time it's normal. What we can see on the x-ray is just bone. We can't see the tendons, we can't see the ligaments. And so usually if we're going to injure a shoulder, oftentimes it won't be a broken bone, it'll be a torn rotator cuff or torn labrum, and so the x-rays will be normal. So just because, and I say this all the time in my office, just because the x-rays are normal doesn't mean you didn't get hurt, it just means you didn't break something, right? So you can still be severely hurt and have a normal x-ray. So if you have a traumatic event and you're not better within, 3 or 4 weeks, it's probably not going to just get better after that. So you're better off going to see somebody, get a good evaluation, and kind of go from there. Determine whether you need an MRI, determine whether you need physical therapy, right? Because those are the things that we do short of surgery. This is important that the vast majority of people I see in my office for shoulder pain don't require surgery. They require maybe an injection, maybe therapy, maybe just anti-inflammatories, a home exercise program, right? So that would be something that we can do that you may not know how to do if you're just Googling this home, you're looking at my videos. My videos are fine, and there's lots of videos out there about shoulder pain. But oftentimes that's not really enough. You really need to see you personally, to evaluate you personally, to find out the information. So that's what I would say for the traumatic event. The chronic event is a little bit different. Your chronic event, say, yeah, my shoulder's been kind of hurting me for a while. It's not so bad, but it's getting maybe more annoying. It's the intensity or the occurrence, how often it's happening, begins to increase over time. If that's the case, then it's probably time. So the key thing, and where I see people in my office all the time, what triggers them to say, hey, okay, I better go see and have this looked at, is actually pain at night. Wakes them up from sleep. That's probably a good indication. If I'm having a pain at rest, pain at night, then I probably need to have somebody take a look at this, try and figure out what's going on. Is this just irritation, bursitis, tendonitis, or is this a rotator cuff tear that's just finally worked its way through? So you maybe had a small tear, or what we call a partial tear. It's not quite all the way through, it's just a little bit of the way through, but as time goes by, it gets farther and farther away, and then it becomes a full thickness, or at least a high-grade partial thickness tear, and those become symptomatic even at rest often. In the chronic time frame of shoulder pain, it probably has more to do with, okay, it's escalating, it's getting worse, it's making me hard to do my job, or making it hard to take care of myself, or it's waking me up at night. Then you go, okay, it's time. I need to have someone take a look at it to try and help direct me in what the next step is to try and make this shoulder better. So I hope that helps. The timing of when you see someone for your shoulder is not cut and dry. There's not a definitive. If you're worried, best thing to do is get it taken care of. Just know if you go to the emergency room or urgent care and they get x-rays and they're normal, that doesn't mean you didn't get injured. It just means that the x-rays are normal. And sometimes, unfortunately, if you go to urgent care, they may not be experts in reading shoulder x-rays, so they might not be able to tell you right then. They may have to wait for the radiologist to read it a day or two afterwards and then give you the information. Urgent care is a good place to start if you're having issues, but also understand that that might not be the end all be all. You're still probably gonna need to follow with someone who has more experience specifically looking at shoulders. Hope this helped, and we'll be coming back with another episode soon. If you have any questions, please put them down below. Please subscribe. I'd love for you to subscribe to all the videos. We have about 30 of them now, and we'd love for you to take a look at them all and help educate you. If you have any questions, if you have any videos that you would like me to make, I'd be happy to. So please write that in the comments. Can you do an episode about this or that? I'd be happy to do that. All right, thanks, and have a good day, and we'll talk to you soon.